I would request the chairpersons to please honor our speaker. I would request the chairpersons to please introduce our expert speaker.
Dr. Balram Ji Omar. He's a professor at the Department of Microbiology, All India Institute of Medical Sciences, Rishikesh. He had done his MD Microbiology from King George Medical University in 2005. And he had an experience of more than 15 years of research experience with national and international collaborations, and having more than 72 publications and book chapters in national and international journals. And he's also a general editorial board member and reviewer in more than 14 national and international journals. So we all welcome Dr. Balram Ji Omar to deliver his lecture.
It's nice to be here on this dais from the college, from the institute where I've studied, where I've been nurtured like anything. Thank you all my teachers. Thank you Principal Sir. And today's my topic, what I want to message you, that we have been evaluated like anything. Our diagnostic has from the animals to the automation system. The technique is now from those ducks, dogs, mice. Now we have carried to the mechanical learning, machine learning, the artificial intelligence. So my topic is from animals to automation, a syndromic approach of testing by multiplex PCR microarray system. So this is my institute, AIIMS Rishikesh, a spiritual city. So you can see from 1925 to 19, it was the animal inoculation, monkeys on the mice, the embryonated eggs, the diagnostic was developing. In 1950 to 1965, the cell cultures were made, the cell lines were developed, and from later on in 60s to 80s, it was the serological or the immunoassays or the radio immunoassays were developing. And finally, there was a revolution, a large revolution. We turned to the molecular level, the recombinant DNA technologies. And finally, it's the automation. The machine has taken over the diagnostics, but the human brain is the biggest machine, biggest automation that cannot be ruled. So as per the International Union of Pure and Applied Chemistry, automation is defined as the replacement of human manipulative effort and facilities in the performance of a given process by mechanical and instrumental device that are regulated by feedback of information, so that an apparatus is self-monitoring or self-adjusting. खुद डिसाइड कर लो क्या एडजस्ट हो रहा है, क्या कंट्रोल्स हो रहे हैं, खुद टेस्ट कर लो. बट फाइनली there's again I will re-emphasize, the human learning is the best over the machine. मशीन कुछ गलत भी पड़ेगी तो ह्यूमन माइंड उसको सही कर सकता है. So it was a type of automations, different automation are type been developing. It is the modular automation, selected modules like analyzers, different analyzers, and the laboratory automation system. And now there is a concept of total automation of the laboratory, which is a very actually manpower is also basically a limitations in the institutes also, in the laboratories also. So these things are developing. The technical persons are less, and we are doing more and more diagnostics. So we will just jump through the different machines which are being used in present situation. The chemiluminescent immunoassay, you can see the time of diagnostic is very limited, and these are high throughput machines, and they can give thousands of results within hours. So as we all know, that is, these luminescence machines are the based on the fundamental of emission of the visible of near visible radiation, which is generated when electron transition from an excited state to the ground state. That gives the luminescence, and that is red automatically. So these machines are highly specific, highly sensitive, and very high through output is there. Another is the automated ELISA systems. These are also very efficient, which we in initial days there were different semi-automated machines in which we read the ELISA readers and all ELISA systems, and we have to put each thing manually. You just put the sample on the tray and you will go through like anything. Now this is the latest technology, the Panther system. In the COVID days, it was used from in the US, UK, and in our institute we have bought this, and it's almost 1,000 tests in a day. More than 1,000 tests in a day it can be done. And it's not only uses for the COVID, it can be used for other viruses also. Other simple systems are like PCR extraction machines, are real-time PCRs, and the different gene sequences. Now, in the time of COVID, we are also seeing the sequencing machines. Now, these sequencers are very versatile. They tell us about the different variants, and that variants, according to that, treatment is also moduled, and the diagnostic is also moduled, and the epidemiology is also moduled, and the prevention is also moduled. Another what I've told you, the total laboratory automations. BD and bioMario people are doing for the microbiology systems. They are doing it right from the culture preparation of the culture media to the streaking of the material, and also automated reading also. Now you have just to visualize each thing, and total automation is there. They're expensive, but it is existing now. So I will come fast towards my topic, actual topic, that is the syndromic multiplex PCR testing approach. So what is syndromic? The syndromic means symptom-driven broad grouping of the probable pathogen into one rapid test that maximizes the chance of getting the right answer in a clinically relevant time frame. अब हम जैसे a lot of time we see disease. Now all the clinical symptoms are all alike. So what we have to do, we are not knowing it is infection due to virus, it is infection due to bacteria, it is infection due to fungus. Now this system takes a small chip, and there are a lot of probes in it, and you with a simple single sample in a run of 2 hours, you get a diagnostic what it is, and that will help in management. So I will take you to a small case study. Like 5-year male, fever, have no chills and rigor for 2 days. There was a fever spike of 101.3 degree, vomiting and headache. Neck stiffness was positive. CRP was negative, leukocytosis, neutrophilia. CSF cell count was 560 by millimeter cube, and 80% with polymorph, glucose 67, protein 45, MRI normal. अब इसमें देखने पे लग रहा है कि क्या है ये? Now when we do this with a syndromic approach, the answer comes to be encephalitis meningitis panel, that is positive for enterovirus. And with a normal microbiology, we can't diagnose this. And there are a lot of cases which are reported worldwide with these enteroviruses. And I want to re-emphasize again that use of antibiotic in such cases, unnecessary use of antibiotics will be there. So we can save those antibiotics, we can save those cost-effective mechanisms, and as you know, whole world is running short of antibiotics. Number of antibiotics are less. Another case study, 68 years old male admitted in emergency, history of maculovascular rash over the right buttock since 7 days. This was followed by similar rash over left tongue and lumbar region. 1 day before admission, altered behavior and fever, no headache. Now, MRI was done, but nothing significant. CSF was also not significant, urine, blood culture, they were all sterile. So what comes? The diagnosis of herpes zoster. Now you get the diagnosis, right diagnosis, you will give him the acyclovir and it will respond. Now these, some of the chest x-rays, they show different type of alveolar infiltrates. They all look alike. What it is? So you can see these are different panels. You can see the human rhinovirus, human metapneumovirus, EVD68, adenovirus. These are diagnosed with the syndromic management. You don't have to give the antibiotics here. So if the clinical symptoms are all alike and you are not getting not getting any positive thing in the routine diagnostic, you have no option other than to just give a trial of medicine, right? So it is a time consuming process, labor intensive. You have you have to use lot of diagnostic tools which are time consuming, labor intensive, technically complex, low yield, cost and overheads, limited coverage, and lack sensitivity and specificity. And moreover, there is cost factor also. So we have to do a syndromic approach. So this gives a faster and better results because it is easy 2 minutes of hands-on time, gives result in 1 hour, comprehensive panels are there, and it is a closed system, so there's no contamination or reduced rate of risk of contaminations, and has got a very high sensitivity and specificity also. So I will take you to a journey, small, how it works. This is a, sorry. There is a this is a kit which is being used, has got a sample extraction and preparation system. It has got a first stage multiplex PCR, the second stage PCR, and you see what you have to do in the 2 minutes. The pouch is inserted into the loading block. The hydration solution is injected into the pouch through the blue inlet port. The sample buffer is added to the sample injection vial. The sample is added to the sample injection vial using the transfer pipette. The lid of the sample injection vial is closed and the vial is inverted 3 times to mix the sample. The sample buffer mixture is injected into the pouch and through the red tube it is injected, and the instrument is now ready to set up. This is the instrument, which is a multiplex PCR system, and it takes about 65 minutes run time. The sample moves into the lysis chamber. Cells and pathogens are lysed by beating, releasing nucleic acids, and these nucleic acids are bound to the magnetic beads. An elution buffer removes purified nucleic acid from the magnetic beads. Nucleic acid moves to the first stage PCR chamber, and the reverse transcriptase enzyme converts target RNA to DNA, followed by high order multiplex PCR, and the products of the first stage PCR are diluted to remove any remaining PCR primers. And finally, these are the small chips, small wells on which these amplified DNA binds, and these are finally detected by the assay system, and you have got the melting curves which is automatically read, and with this automatic reading you get to know the type of pathogen which is involved. So these are different panels and these are automatically read, so you get a good result in within 2 hours. So 2 minutes. So these are the different panels. You see, a single panel has got 33 targets. We have 33 targets in a single panel, And all these bacteria, atypical bacteria, viruses, antimicrobial resistance, genes are also detected. This is the respiratory panel which has got 21 targets. The meningitis, encephalitis got have 14 targets. The blood culture identification system has got 43 targets. And there is a new panel also which detects also the bones and joint infection panel. To summarize, the need of the R is, it is a fast, easy and comprehensive. With over 100 targets, it can detect. And the benefits of this syndromic testing is high impact on the patient management and the cost, a guide to early therapeutic adjustments, a tool for better and safer patient isolation, improved patient management, a significant impact on the healthcare cost. Everything is being worked on today, on the antibiotic stewardship and to reduce the cost. So this is a costly test, but if multiple tests of being done for the same thing, it will be a higher cost. So it is cost effective also. And suppose some viruses is detected and you are giving vancomycin, linezolid and these type of drugs. That also adds to cost and it harms the patient also. So this is a cost effective, very cost effective and very benefit giving syndromic approach. And there are limitations with every automation system which is exist. I told you that nobody can compete with the human brain. And that is from my side. Thank you. And I will like to invite all you to Rishikesh anytime, anywhere. And most welcome, sir. Thank you. Thank you.
Thank you, Dr. Balram Ji Omar, for giving a crisp talk on such a wide topic.